Devon produce the spots free. That's right, free. Call Devon C now at 248-357-4566. That's 248-357-4566. Or email at d.calhoun@thewordnetwork.org. This excludes political ads.
Attention! Do you owe back taxes, fines, and penalties to the IRS? The IRS now offers new relief options for taxpayers affected by COVID-19, but you can't go it alone. Call Tax Solutions now. Our team of former IRS agents and tax professionals can get you the best deal. We know the COVID-19 rules. Call us and never speak to the IRS again.
I couldn't sleep. We were being audited. I called Tax Solutions now, and a great big weight was lifted off my shoulders.
I called Tax Solutions now, and they got the IRS off my back.
Tax Solutions now had my wage garnishment lifted in 48 hours.
The virus has caused the IRS to take extensive action to help taxpayers. So if you owe $10,000 or more, this is the best time in years to settle your tax debt.
I qualified for the Fresh Start program. I paid less than I owed.
Remember, the IRS will not give up until you pay. Call 800-683-9499. 800-683-9499. 800-683-9499.
WADL gets a facelift and is now My 38 Detroit. Along with a facelift comes new programming. On Mondays at 8 p.m., catch a 2-hour block of Law & Order SVU. Tuesdays, Chicago Fire. Wednesdays, Dateline. More Dateline and Chicago PD on Thursdays and on Fridays. You'll get more Chicago PD to start your weekend. We'll still have some of your favorite shows like Mom, Blackish, and Friends. Just adding more for you to enjoy on My 38. The Word Network has been broadcasting inspirational messages around the world since the year 2000, and we keep getting bigger and better and more innovative. Seen all around the world, we bring you the best teaching, impartation, singing, and inspiration. If you want original programming, we have that too. The Word Network is your exclusive source for all things inspiration, and we can be found on every device imaginable. If you want to be uplifted and inspired, you need the Word Network.
My 38 is offering a great special that cannot be refused. Are you looking for a great deal on TV advertising? Are you searching for an avenue to get your business name out to the public? With My 38, we are offering a great special with 100 commercial ads for a great price. This offer is for a 30-day ad placement. Please contact Devin C. for more information at 248-357-4566 or email at d.calhoun@thewordnetwork.org. This excludes political ads.
The weekend lineup on 910 AM is crazy.
I am your host, Nurse Charms, the nurse of morning radio, here to bring you the most accurate and up-to-date information in health, wellness, nursing, and medicine. Listen, information is power and information is currency, so we do not do misinformation over here. Stay locked in with me, and I promise that you will not be disappointed. From 6 a.m. to 8 a.m., chime in on the discussions that we have on this show so we can hear from you.
910 AM Superstation. WFDF Farmington Hills, Detroit. 910 AM Superstation, a division of Adele Media. The views and opinions expressed on any program are those of the producers and or the persons appearing on the program and do not necessarily reflect the views and opinions of 910 AM Superstation or Adele Media.
Good morning, Detroit and listeners around the world. Happy Sunday. You are listening to 910 AM Superstation, and this is Nurse Charms Live. Yes, I am live in the studio this morning, and it is so great to be here. I am your host, Nurse Charms, the nurse of morning radio, here to bring you the most accurate and up-to-date information in health, wellness, nursing, and medicine. Listen, I am excited and blessed to host this show every Sunday from 6 a.m. to 8 a.m. So first and foremost, thank you to those of you who tune into my show each and every Sunday from 6 a.m. to 8 a.m. Now, before we get into today's topic, I always want to tell people about my background. I am an experienced registered nurse of 21 years. So as someone who has been in the profession for 21 years, it is important for me to shed light and break down important topics in medicine so that everyone can understand what is going on in health news. So my hopes with this show are that individuals will use this information to make choices that will benefit their life. In addition, when individuals make better health choices, ultimately our communities become healthier and we can all live a more productive life. So as I said, I'm a registered nurse who is actively licensed by the state of Michigan for 21 years, and currently I am employed with a local hospital. I'm also a licensed massage therapist of 10 years and a serial entrepreneur. So that's my background, and I'm sticking with it, and I'm going to always start off my show letting y'all know that I have my street creds, okay? However, this is also the people show. So that means I want to hear all of y'all's opinions on certain topics. I don't want to sit here and dominate the radio show without letting my callers express their thoughts. So please call into my show, okay? The number here in studio is 313-778-7600. Again, 313-778-7600. I want all of you to chime in on the discussions that we have so that we can hear from you. I will always do my best to try to answer your questions with research and facts. And if you're watching the show on the 910 AM Superstation Facebook page, please drop a heart emoji and share this video, okay? Because that lets the Facebook algorithm know that this is good content, and they will continue to show this video to more and more people so that we can get this content out there. I also want to mention that we are streaming live on the 910 AM Superstation app. I personally have the 910 AM app on my phone, and I recommend that everyone else goes and gets the 910 AM app, okay? You can download that app in the App Store. We can also be heard on the iHeartRadio app and the TuneIn Radio app. And lastly, you can always visit the 910 AM website and watch us live in studio. So there are plenty of ways to listen to the show without any excuses. That means I want y'all here every Sunday, 6 a.m. to 8 a.m., okay? This morning, Nurse Nicky is joining me live in the studio as my guest co-host. So if you're watching on the 910 AM Facebook page, our website, or the 910 AM app, you can see Nurse Nicky in the studio with me. Nurse Nicky, wave to the camera.
Good morning, everyone. Good morning.
Yes, but really quick, before I officially welcome Nurse Nicky, I want to give a disclaimer. I always give this disclaimer that neither myself nor any of my guests are being endorsed. Therefore, I want everyone to know that we are sharing our own knowledge and experience with hopes it will be educational and add value to everyone listening. But please remember to always consult your personal physician, okay? This show is for educational purposes only and not diagnosing purposes. Well, good morning, Nikki. Nurse Nicky, how are you?
I'm absolutely well. How are you doing this morning, Sunday morning?
Great. Yes, I'm feeling good. I think I'm going to go get a pedicure today. So I was just thinking, like, what can I do today? Because, like, I'm off all day. So I'm just like, I don't know, because I'm always busy doing stuff. So
that's good. Self-care is important.
Yes, for sure. So, Nurse Nicky, give everyone your background. You know, it's always important because people may like, who's that in the studio, or what are they talking about? How do they know what they're talking about? So let them know. You got the street creds.
I do have the street creds. I am accomplished. I have been a registered nurse in the city of Detroit for, since December of 1996 is when I graduated. Worked a lot in hospitals and healthcare systems, a lot of emergency nursing background, a lot of work with the DMC, some work with Henry Ford Hospital, acute inpatient rehab facilities as well. Currently working with a federally qualified health center, which multiple health centers across the city of Detroit, and you can find FQHCs across the nation, which really work to serve people that are underprivileged, giving them access to really great health care, working on the social determinants of health, and really reducing the biases in healthcare that go and contribute to a lot of the issues that we see in our communities for Black and brown people. I'm also a holistic health and wellness coach, a huge interest in holistic health and wellness, and I am a transformative energy body worker, Reiki therapist, yoga teacher. So just a huge interest in natural health as well. along with my allopathic interest in nursing, background in nursing.
Love it, girl. You are the bomb. All right, so this morning we're having a discussion about sexually transmitted diseases. April is STI Awareness Month, which stands for Sexually Transmitted Infection. We kind of use those terms interchangeably. Sexually transmitted diseases, STD, sexually transmitted infections, STI. So we're on the tail end of this whole awareness month, but I wanted to take the opportunity to continue raising awareness about STDs, getting tested and getting treated. So if you are someone who has sex, then you need to be listening to this show, okay? Don't be one of those people, I don't want to talk about that, No, y'all need to listen to this show, even if it's not for yourself. Pass on the information, okay? Knowledge is power, like I always say. We must erase the stigma of STDs by talking more about this subject. This is a public health issue, and STDs can impact the future of your sexual health if they are not treated early enough in the infection course. As a matter of fact, the CDC recently released a report which says that the rates of chlamydia, gonorrhea, and syphilis are on the rise. So this means that the numbers of people who are testing positive have skyrocketed and have been the highest that they've seen in 20 years. So it's important to know your STD status and share your results with your partner so that you are both on the same page. So we're going to get into this discussion this morning. Please call 313-778-7600. I see callers. Y'all already calling in. I love it. 313-778-7600. I want to know from all of your perspectives, what are some reasons why people are embarrassed to talk about STDs and go get treated? You would think that people care about the people they love and want to protect their health. So again, please call 313-778-7600 and share your comments. So Nurse Nicky, I was looking at the data for the state of Michigan, and the thing that came to my attention is that Black people only represent 14% of the population, yet the data says that 56% of Black people are infected with STIs. So what do you think are some of the reasons for these health disparities among Black people?
Well, some of the reasons are, our lack of resources, our lack of education, the stress in our lifestyles, and sex is a relief. It's a stress reliever, and then people turn to it. And so I think the lack of education and resources contributes heavily to it, just as much as it does with any of the other health conditions that affect us in our community.
It's like we hear this all the time. It's always Black people are at the top for everything. We have the highest COVID rates, hypertension, diabetes. It's like, why is it that our community is always we're at the top for everything? Like, what can we do better?
Well, it's going to take some willingness to start to do things differently. The information is out here, and we have to learn. We have to take things to heart. Some things, again, is resources, is education, is lifestyle, is stressors. And so even when we present for care, we're not always treated the same. We don't always get the same treatment as other people. So we're going to have to really do a grassroots type of initiative to really get things going, because what we've been doing lately just hasn't been working.
Yeah. And then, of course, there's this distrust in the, for medical care providers. It's just been like that, for years and years, stemming back. So let's see. We have some callers on the line. I see Fidel. Good morning, Fidel. How are you?
Good morning, ladies. How y'all feeling this morning?
I'm
Feeling
excellent.
Good to hear from you.
Good. Glad you ladies brought this subject up. It's much needed. Black people is scared to talk about a whole bunch of things, and sex is one, because we've been so Europeanized. Let's just say that real quick. Two, do any of you ladies remember Herman Kiefer?
Yes.
Mm-hmm.
See, we had places where, the average Joe Blow, showing or not, could walk in and out the street, get their sexual transmitted disease, or just simply get checked out. They can get that problem solved. People don't have that no more. People don't talk about it. And like you say, when it's something that's bad out, we high on the list. I guarantee you we ain't high on the list on ownerships and getting our own bonds and grants and contracts. But to stay on the subject, how do you go from catching diseases, let's just say in the 70s and 80s, to where you might have some symptoms, some discharge, and to nowadays there's no symptom.
Yeah.
You know what I mean? How do you go from, like you say, syphilis and this and that to herpes to AIDS? Now you got HPV, and you got all this other stuff, and it don't even detect it. Where's all these diseases keep popping up and coming up from, ladies?
And that's the scary thing, and that's why it's so important to, raise awareness about this, and most importantly, go get checked. You have to go get checked, especially if you're not in a monogamous relationship. If you're just kind of out here having fun. I was talking to Nurse Nicky about this yesterday. I'm like, the slogan needs to be look before you what did I say?
Look before you lick. I don't know.
I said look before you lick. Oh, we're gonna get into that later, because it's another some more research about oral sex leading to throat cancer. So we're going to get into that topic a little bit later. But yes, it's just so important to get tested. If you're sexually active, I would recommend people get tested at least twice a year. But if you're like with different partners, every time you switch a partner, I feel like you should get tested. Or if you feel like your partner might be unfaithful, you definitely want to get tested. But just getting tested is the most important thing you could do to answer your question about, it being asymptomatic.
Yeah, I don't know why it's asymptomatic, where yesteryear you have, all these different symptoms. Maybe it's the way that, viruses and bacteria evolve. I mean, we've seen it with the COVID virus, where it's been mutating. So maybe it mutates and just shows up differently. I don't really know. But that's one thing that we need to be aware of, is that, there are some things that you cannot see, taste, touch, or feel, and it's there. For instance, the herpes virus, it can live on the skin without any visual notice at all, and so it is transmissible, from just the skin, from it shedding on the skin, no open lesions or anything. And then some women, feel like that it's just a hair bump or something like that. And actually, the last statistics I read was 1 out of 2 black women have some type of herpes. Same thing with HPV. You can't see it all the time.
All I'm saying, lady, you can't even lay down with a woman now. You can't eat no real food. You can't drink no clean water.
We gotta go to break.
Thank you, Fidel. Listen, if you want to call back later, you're more than welcome to it. We have to take our first break. This is 9:10 a.m. Superstation. You are listening to Nurse Charms Live, and Nurse Nicky is joining me as co-host. We'll be right back.
Have you thought about advertising your business on our 9:10 a.m. Superstation? Our audience is bigger than ever, and your investment will be lower than ever. Find out how you can grow your business. Give us a call during business hours and ask for Henry, 248-357-4566. We will tell your story, and more folks than ever before will come to your door. 248-357-4566. Ask for Henry. The super audience at our 910 Superstation wants to hear about you. Call now.
Did you know most vitamin supplements don't even come from food? Even the products with colorful fruits and vegetables adorning the labels are seldom derived from produce. Typically, supplements are synthetic, made in a laboratory. Modern science may synthetically imitate these chemicals, but your body isn't fooled. It knows the difference, and it craves quality materials to build, repair, and fight illness. You need to consume fruits and vegetables daily in a variety of colors, as well as whole grains and other fresh food. That's why I formulated Balance of Nature. I wanted to be able to give my patients a natural alternative to the cheap, unnatural chemistry by giving them real fruits and vegetables. In fact, the only ingredients inside of Balance of Nature are whole fruits and vegetables. Don't settle for imitation nutrition. Reach for the good stuff, the real stuff.
Call 1-800-246-8751 or go to balanceofnature.com to get 35% off your first preferred order by using discount code RADIO5.
Do you have an idea for an invention or new product? Do you think companies would be interested in your idea? Do you want to try to get a patent? Then call InventHelp now. InventHelp keeps your idea confidential and explains every step of the invention process. We create professional materials representing your idea and submit it to companies who are looking for new ideas. We have more than 9,000 companies who have agreed to review ideas in confidence. If a company shows interest in manufacturing your invention, we can negotiate on your behalf. We have helped over 10,000 clients receive patents. We also offer services including 3D modeling and animation demonstrating your idea, prototyping services, and we use state-of-the-art technology to show InventHelp client ideas to additional companies. Join the thousands of people just like you who chose InventHelp to pursue their idea. We are experienced. We are working for you. We are InventHelp.
Call us for free information at 1-800-460-1663. That's 1-800-460-1663. Again, 1-800-460-1663.
So Gorgeous is the latest brand to hit the hair extension and wig market. Made from 100% human hair donors with textures to perfectly blend into your hair, giving you full, natural-looking styles with added volume and length. You can wash, color, curl, and straighten our gorgeous bundles and wigs. Shop our collection now at SoSoGorgeous.com and get ready to show off your gorgeous hair.
Happy National Nurses Month to nurses across the world. Thank you for your unwavering commitment to high-quality patient care. You truly make a difference every day in so many lives.
910, the Superstation, the oldest radio station in town since 1922.
Live, this 9:10 a.m. Superstation. I have Nurse Nicky in studio with me. This morning we are having a discussion about STDs or STIs, sexually transmitted infections. And I want everyone to call in 313-778-7600 and let me know what are some reasons why people are embarrassed to talk about STDs and going to get treated. You would think that this is something that you would want to share, share your status with the person who you're sexually active with. So let's just get into this discussion. I have some more topics that we're going to talk about, but let's get to our callers first. Let's see. Good morning, Richard. Hi, Richard. Are you there?
Yes, I am. I think the problem now, I moved from Detroit in 1974 to San Francisco. In Detroit, I stayed here for about 6 years. I never got any STDs.
All right.
I got to San Francisco. I was in a VD clinic every other month. The lady over the VD clinic said, "You like a little dog in here. Don't have to quarantine you if you keep coming up in here." That lady wound up having a relationship with me. She was 17 years older than me. And you know what she taught me?
What's that?
You stay with one lady. You don't deal with a whole lot of women.
That's good advice.
You be faithful, and what you do, you always be honest. She said it's okay to look at another woman, but don't chase her. She said it's okay for her to look at another man. You don't chase him. It's called dedication to your partner. The problem now is all these children that are growing up that are going to be adults soon, you have to think about this, young lady. Most of these black children can't even hardly read and write.
That's
in
true.
A lot of these schools, they used to teach us sex education. How you going to teach a kid that can't even read and write on their level anymore?
That's a great point.
They don't even know how to talk to each other anymore. They're too busy shooting each other.
Yeah.
Somebody needs to sit down and do one thing. All men who have had a child that are not raising them, there needs to be some kind of commitment, like some type of incentive to get black men or just men of color to make a commitment, have meetings at schools, even though you might not be with that lady who had the child by, you still need to get with that man. Y'all need to have like an extended family say, okay, I know I'm not involved in your life. You with this lady, now you with this man now. But we want the best for this child. So I'm here. I've been out of his life. What do y'all need me to do to come back in his life with some positive stuff. That's not happening anymore. I got nothing else to say.
Thank you for calling. Appreciate your perspective. Let's go to Jerry. Good morning, Jerry. How are you?
Good morning to you, my beautiful nurses.
Good morning, Jerry.
And Nurse Nicky. Thank you, dear. How you doing?
Well.
Doing great.
Beautiful. You know what? 1 week passed like 7 seconds. It was just like yesterday. I was addressing my question to you, and here we are living another Sunday.
Yes.
So God bless you. God bless the viewers. We are alive, and thanks God. Nurses Charms and Nurses Nicky, of course, when we're talking about those sexual diseases, I want to let the viewer, we are not talking about my personal life, or we are talking in general.
Right.
Question, and I respect everybody's question. My question here to you, my dear nurses, syphilis disease, we know that sexual disease. My question will be, put it in 3 parts. Part 1, how do you know when the person has a syphilis disease? The second point, how do you treat this disease? The third point, is the syphilis disease will affect the life of the individual, especially when they get married and they have children, as that will affect their children in the future? I would appreciate the answer, and thank you for your service, and God bless you.
Yes, thank you for your question. Those are great questions. So first, let's just answer his question. He wants to know, what is syphilis? Syphilis is genital warts.
Well, syphilis is, HPV is the genital warts. Syphilis affects you on the inside. It affects your neural system, the brain. It travels throughout your body, and you have a primary and secondary syphilis, and you have latent syphilis. And sometimes right now it's presenting without symptoms. I'm working in the clinic, and I remember last year one of our primary physicians said that she had seen more syphilis cases in the first 3 months of last year than she's seen in her whole career, and when she's been practicing about 40 years now. And so it had been on the increase. They stated a few years back that it was coming up in Wayne County and Detroit, especially on the east side. So now we see it really playing out with the numbers that we see to increase. But they're doing blood work just on annual physical exams, and it's showing up in the blood, without any symptoms. And so that's one thing, is not showing up. Some people will get it and they'll see like a canker sore or some type of ulceration on the genital area.
Right, that's what I'm saying. You'll see those.
Yeah, so you may
warts,
see an
the
ulcer area.
The ulcers, yeah.
But then that goes away, and then you don't have any signs until, later on, which you start developing other types of symptoms when it gets late.
Right.
So
it can affect all of our organs, like Jerry was asking. Mm-hmm. And ultimately, those complications can lead to death. It can affect our heart, it can affect our brain, it can affect, all of our organs. So again, it's important to get tested. So we gotta erase the stigma. Like, some people, they don't want to go get tested, I guess being seen at a clinic,
Mm-hmm.
but you can't worry about things like that. But maybe that the government can provide more tests, make available.
Well,
home testing.
Yeah, a lot of people are being seen in the emergency departments. That's one place that a lot of people in the city go to, is the emergency department. You can't turn people away, so that's one place people get seen. Go to a clinic and get seen. You can still have access to the Department of Health, the health departments in the local counties in Detroit. You can still access care through there. But he asked about the treatment also, and so the treatment for syphilis is, it's a bicillin shot, which is a form of penicillin. So it's 2 injections that people get, and some people still get a reoccurrence of it. And then he asked about, do you have to worry about it infecting your children? That part I've done more research on. I haven't heard of it being transferred to babies in utero, but that's something to look up. I hadn't read anything like that before in the past.
Right. So let's talk about, as a whole, what do you think is driving up these national STD rates? Because it just seems like after COVID, the syphilis rates doubled, And specifically in Michigan, the gonorrhea and the chlamydia rates are up. So let's just talk about that.
Yeah, chlamydia has been like the number one, sexually transmitted infection for quite some time, and a lot of times it goes hand in hand with gonorrhea. People present with them at the same time. Why the rates are going up? Look at what's going on in the media. There's a lot of sex in the media. There's a lot of things that we didn't see on TV a long time ago. It's just commonplace now, and it's actually a lot more graphic, a lot more detailed. So sexual intercourse is a lot more acceptable amongst people that are not in relationships or married. And not saying that that's what you're supposed to do. I'm just saying that people are just more loose about doing it. And so then you have more treatments for these different sexually transmitted infections. So people are now just thinking, oh, well, I'll just go get a pill, or I'll just go get a shot. And now with HIV being more treatable and people getting pills and things to prevent it, pre-exposure prophylaxis, people are just more casual about sex than they have it in the past, thinking that they can just go and get it fixed. Where when you look at some of these infections, some of them are actually more resistant to antibiotic treatments than they have been in the past, especially the gonorrhea.
Yeah. Let's get back to our callers. If you all want to call in, the number here in studio is 313-778-7600. Good morning, John. How are you?
Oh, I'm doing great. Can we talk about these sexual diseases, these transfer diseases? Can we say that we have an open border country and nobody's being checked who's coming in? And another one I got for you is any virus, they can find the origin of the virus. Can we talk about how come it is they can't, the COVID virus, they can't track that one down to its origin source? It's a man-made virus. And I'm not a doctor. I'm not a nurse. I just wonder. And that's all I have. Thank you.
Thank you. Thank you for John. That's a great perspective. As far as the virus, I don't know. Like, they never just gave us one conclusive source. Did it come from a lab? Was it from this wet market? Have the government ever given us a conclusive answer for how it started?
No. No, they haven't. And at this point, I think we all just have to recognize that it's here, and what can we do about it to keep ourselves safe, Yeah. So diving down that rabbit hole is a deep dive, and one that we're not prepared to answer today.
All right. On that note, let's take our second break. This is Nurse Charms Live. We'll be right back.
Balance of Nature's fruits and vegetables in a capsule, changing the world one life at a time.
I had no energy for months and months and months. I had no energy, and I'm a very active person. And my husband was noticing that I was tired all the time, and I was slow at everything that I was doing. And I kept listening to the commercials. And, you don't know if something's going to help you or not. But I decided this was something I was going to do. And lo and behold, in about 4 days after taking them, I was repotting plants. I was doing other things. My husband said to me, "You seem to have more energy." And I said, "Oh, yeah, I'm fine." And I'm telling you, nothing has ever made such a difference. So anyway, I'm very happy.
Right now, Balance of Nature is offering free shipping and 35% off on any new preferred order. Call 1-800-2468-751 or go to balanceofnature.com and use discount code RADIO5.
Attention! Do you owe back taxes, fines, and penalties to the IRS? The IRS now offers new relief options for taxpayers affected by COVID-19, but you can't go it alone. Call Tax Solutions now. Our team of former IRS agents and tax professionals can get you the best deal. We know the COVID-19 rules. Call us and never speak to the IRS again.
I couldn't sleep. We were being audited. I called Tax Solutions now, and a great big weight was lifted off my shoulders.
I called Tax Solutions now, and they got the IRS off my back.
Tax Solutions now had my wage garnishment lifted in 48 hours.
The virus has caused the IRS to take extensive action to help taxpayers. So if you owe $10,000 or more, this is the best time in years to settle your tax debt.
I qualified for the Fresh Start program. I paid less than I owed.
Remember, the IRS will not give up until you pay. Call 800-683-9499. 800-683-9499. 800-683-9499.
WADL gets a facelift and is now My 38 Detroit. Along with a facelift comes new programming. On Mondays at 8 p.m., catch a 2-hour block of Law & Order SVU. Tuesdays, Chicago Fire. Wednesdays, Dateline. More Dateline and Chicago PD on Thursdays and on Fridays. You'll get more Chicago PD to start your weekend. We'll still have some of your favorite shows like Mom, Blackish, and Friends. Just adding more for you to enjoy on My 38. The Word Network has been broadcasting inspirational messages around the world since the year 2000, and we keep getting bigger and better and more innovative. Seen all around the world, we bring you the best teaching, impartation, singing, and inspiration. If you want original programming, we have that too. The Word Network is your exclusive source for all things inspiration, and we can be found on every device imaginable. If you want to be uplifted and inspired, you need the Word Network.
So Gorgeous is the latest brand to hit the hair extension and wig market. Made from 100% human hair donors with textures to perfectly blend into your hair, giving you full, natural-looking styles with added volume and length. You can wash, color, curl, and straighten our gorgeous bundles and wigs. Shop our collection now at SoSoGorgeous.com and get ready to show off your gorgeous hair.
Happy National Nurses Month to nurses across the world. Thank you for your unwavering commitment to high-quality patient care. You truly make a difference every day in so many lives.
Nurse Charms Live. If you heard that message during the break, that was my friend, Dr. Khan. Yes, National Nurses Month is May 1st through May 30th. So please, if you know any nurses, please thank them for all of their unwavering work and commitment that they do. So let's just get back into our discussion this morning. We are talking about STDs. April is National Sexually Transmitted Infection Awareness Month, and this is the tail end, so we just wanted to address this topic before the end of the month. So callers, I want to know, I'm asking a question, why is it that why is talking about STDs, STIs so taboo? Why don't more people want to talk about it? So let's get back into our callers, and if you want to call in, it's 313-778-7600. Good morning, PG. How are you?
Well, good morning, and I missed you and Nurse Nicky last week.
Good morning.
Hi.
Yeah, where were you? I was like, where's PG at?
You know what? I got caught up into organizing my basement and I didn't go to bed until like really.
Oh, okay.
And then I woke up and I went, and you had just went off the air. And I said, oh, my goodness.
That's okay.
Well, I think the reason why it's taboo is because people just really aren't into talking about it, because I think a lot of people just are not knowledgeable about it. I think a lot of people grew up and their parents never talked about those things. So they started exploring before they had the talk with their parent. And like, I can't remember if it was you or Nurse Nicky that just said, people don't want to go in a clinic. People don't want to be seen.
That was me, yep. Mm-hmm.
Don't want people to know about it. But, you know, if it's you and it's something that can hurt you and your health, you should want to know everything about it.
Right, right.
But then again, you know, when people get ready to have an encounter, if they don't smell right, I know I'm calling in on the radio, and I'm trying to.
No,
be
you're
so
right.
appropriate.
That should be a red flag. You're right.
Yes, that should be a red flag. If they take off their undergarments and it doesn't smell fresh and clean, that should be a red flag.
Yes.
And then for the person, your urine and your poop tells you just about everything that's wrong with you and your body.
Yes.
And you have just got to be aware of it. But I was watching something on TV, Nurse Charms and Nurse Nicky, and they were talking about that these diseases are alive and prevalent now in seniors.
Yes. We're going to get into that also.
How is it that these seniors are catching syphilis, gonorrhea, chlamydia? How are they catching this?
Well, seniors are still sexually active.
Right, they want to have sex just like the young people, and what the data is showing is that it's the nursing homes. You're seeing that they're hooking up with each other in these nursing homes.
Yes.
Now that's concerning because where are all the staff? How is it that people are going in each other's rooms and like this stuff?
Understaffed.
Yeah.
But hey, so Smokey Robinson just released an album. He's 83 called Gasms. Just came out 2 days ago. He talked about, the sexuality of seniors. He said it's not over at 60, 70, or 80. So, seniors are sexually active, and they I guess they feel like, their partner doesn't have anything, and they feel like they don't have anything. And they could be carrying stuff from years ago. Untreated.
Right. Well, I think that a lot of people, you mentioned too about why is there a surge. I think that people got so tired of being in quarantine, having to wear the mask, trying to understand all this information, news data about COVID-19, coronavirus, all these other variants that came about, to the point that when the quarantine and the mask issue was, they didn't require that you do it. I think people just got so tired of just the separation.
That might be part of it. It might be part of it, but when you look at the rates of gonorrhea, they actually went down and syphilis went up. So I think, it may be that syphilis, because you don't see it, and it's just in the blood, not showing up, that people don't know it's there, they can see, or smell if they have gonorrhea sometimes. And so they're getting that stuff treated and being more aware of it, but I think because of the exponentially, it's just growing. And we've seen years ago where they said it's out here, and we see it growing exponentially at this point.
So do you think, Nurse Nicky and Nurse Charms, that that's why the rates are up, or the number of cases are up, because people just wanted to get back into the sexualness, because of the pandemic, and
I think there's multiple reasons. One of the reasons why rates are up, because as Nikki was just saying, like a lot of this is asymptomatic. Some of these are asymptomatic, like for instance, chlamydia. Usually that's something that a woman gets and she'll notice some discharge, but a man, they would go asymptomatic. And as for gonorrhea, something like gonorrhea, a man would have burning. So that's something that they would notice. So it just depends on the gender and what specific organism, bacteria that they have, what infection that they have, and what symptoms they're experiencing. So if they're asymptomatic, then you really don't know that you're spreading it. You know what I'm saying? And then another thing is, the education, and that goes hand in with being asymptomatic, because if you don't know the signs and symptoms of this, but you could potentially be a carrier, so you're going to be spreading the disease.
Yeah, especially with the human papillomavirus, the HPV. That's definitely a lot of asymptomatic. Some people may have some lesions on the outside, on their outer genital area, but a lot of times it may be on the inside. It may be, nothing that you can palpate or feel or touch or see. And the virus is just there, and it spreads. And so people are doing oral sex, and they're catching it in their throat, which then can later turn into cancer. A lot of it gets cleared out, but there's still the chance of it turning into throat cancer and or cervical cancer for women. So it's very dangerous, and it's impacting a lot of people. So we need to really create this awareness of getting tested, talking about it, getting tested and treated. Yeah. And cutting out the stigma of having these different issues.
And remember, years ago, before you got married, they always required each person to, have a complete physical and to be tested, for the various STDs and STIs. Do you think that's something that they need to bring back? Like, are people just trying to now be married for the sake of having one partner, but not knowing the medical health of their partner that they've selected? Like, how do we stop this? How do we lower the cases?
What are the marriage rates? I'd have to know the marriage rates to see if that would be beneficial or not. Are people getting married as much as they used to?
Yeah,
or are people more so hooking up?
Especially in the black population. Mm-hmm. Right. The marriage rates are low if you want to talk about the black population. But yes, to answer your question, I haven't been married, but I personally feel like being in a relationship, definitely being married, I feel like, or engaged, getting ready to get married, I feel like that's best practice. I feel like you should want to know the sexual health of your partner, because what if they have something that they don't know they have, or what if they actually do have something and they're keeping it from you? So in the nature of transparency, people need to be talking about these things. And I just don't understand why people don't want to talk about it. Is it that they're, if they have something, they don't want you to know, or
they don't want you
to embarrassed?
They're being embarrassed about it, or they feel like they may not have the opportunity to have this type of relationship with you. So people keep secrets, and sometimes they just rather not know, because no news they feel is good news, and just ignoring things. It's like it's not there. It's like a kid putting their hands over the eyes, and you don't see it. It's not there. But it's definitely there.
Right. Think about having herpes. Think about having herpes, Yes. So, and, that's something that can also be asymptomatic. And so if you don't know to look for those things, and, you're having sex with your partner, or oral sex, and then you could potentially get this virus, even though they're asymptomatic, then, that
Yeah. Well, and that herpes simplex virus, HSV1, HSV2, a lot of it's being transferred from mouth to genitals, so the type 1 is being transferred, to the lower area because of the incidence of oral sex. And so people are not really thinking about it. It might be something hidden underneath of a mustache. You can't see it.
Right.
And they're transferring it.
Yeah.
I think they should bring sex education back to the schools, because every documentary or news show that I watch that talk about like youth and what they're dealing with, I think these kids, mainly these young girls, think that if they're not having penetration sex.
PG, I'm sorry to cut you off. We had to take a hard break, but I really appreciate your...
Well, I miss you guys.
Yes, all right.
Thanks for calling in, PG.
Okay.
Okay, thank you.
This is Nurse Charms. Love you too. This is Nurse Charms Live. We're going to take a break. We'll be right back.
Have you thought about advertising your business on our 910 a.m. Superstation? Our audience is bigger than ever, and your investment will be lower than ever. Find out how you can grow your business. Give us a call during business hours and ask for Henry, 248-357-4566. We will tell your story, and more folks than ever before will come to your door. 248-357-4566. Ask for Henry. The super audience at our 910 Superstation wants to hear about you. Call now.
Did you know most vitamin supplements don't even come from food? Even the products with colorful fruits and vegetables adorning the labels are seldom derived from produce. Typically, supplements are synthetic, made in a laboratory. Modern science may synthetically imitate these chemicals, but your body isn't fooled. It knows the difference, and it craves quality materials to build, repair, and fight illness. You need to consume fruits and vegetables daily in a variety of colors, as well as whole grains and other fresh food. That's why I formulated Balance of Nature. I wanted to be able to give my patients a natural alternative to the cheap, unnatural chemistry by giving them real fruits and vegetables. In fact, the only ingredients inside of Balance of Nature are whole fruits and vegetables. Don't settle for imitation nutrition. Reach for the good stuff, the real stuff.
Call 1-800-246-8751 or go to balanceofnature.com to get 35% off your first preferred order by using discount code RADIO5.
Do you have an idea for an invention or new product? Do you think companies would be interested in your idea? Do you want to try to get a patent? Then call InventHelp now. InventHelp keeps your idea confidential and explains every step of the invention process. We create professional materials representing your idea and submit it to companies who are looking for new ideas. We have more than 9,000 companies who have agreed to review ideas in confidence. If a company shows interest in manufacturing your invention, we can negotiate on your behalf. We have helped over 10,000 clients receive patents. We also offer services including 3D modeling and animation demonstrating your idea, prototyping services, and we use state-of-the-art technology to show InventHelp client ideas to additional companies. Join the thousands of people just like you who chose InventHelp to pursue their idea. We are experienced. We are working for you. We are InventHelp.
Call us for free information at 1-800-460-1663. That's 1-800-460-1663. Again, 1-800-460-1663.
So Gorgeous is the latest brand to hit the hair extension and wig market. Made from 100% human hair donors with textures to perfectly blend into your hair, giving you full, natural-looking styles with added volume and length. You can wash, color, curl, and straighten our gorgeous bundles and wigs. Shop our collection now at SoSoGorgeous.com and get ready to show off your gorgeous hair.
Happy National Nurses Month to nurses across the world. Thank you for your unwavering commitment to high-quality patient care. You truly make a difference every day in so many lives.
Listening to Nurse Charms Live. We are live in studio this morning and we are having a discussion. It is STI Awareness Month. April, all of April is STI Awareness Month, and on the tail end of this month we wanted to have this discussion about STDs. So call in. I want to know, why is it so taboo to talk about STDs? It's so important to know your sexual health status. So we must go get tested. We must be transparent about our status with our partners. So let's have this discussion. So right now we're going to just break down what is chlamydia, gonorrhea, and syphilis, and what are the signs and symptoms? How do you know that you have it?
Okay, so chlamydia being the top sexually transmitted infection, sometimes you don't have any symptoms at all. Sometimes there's like a watery discharge. Some people may have a little bit of genital pain, but a lot of times chlamydia is really asymptomatic, no symptoms at all. And
Right.
So you see people present with it. They just come in for a regular pap smear and they get, STI checked along with it, and it'll pop up. And they say, oh, no, I didn't have any symptoms at all. But those are some things that a person may have. And again, it could be a watery discharge or some type of discharge from the genital area. When you're looking at HPV, the human papillomavirus, that one, it may show some signs of some genital warts where you can actually see them on the vulva of the vaginal area or on the penis. But sometimes there's just no symptoms whatsoever. The virus is there, and it could be shedding without any symptoms at all. And there's so many different various strains of the HPV. But just know that you may not have any symptoms whatsoever. When you're looking at genital herpes, and you have HSV1 and HSV2. So HSV1 is the one that wants to live in the the mouth region,
Right.
and HSV2 is more in the genital region.
Right.
You can catch either one in both areas, but you may not see very many outbreaks if you have HSV1 type 1 in the genital area. So it may have one eruption, you may not see it again until years later.
Right.
But
and then some people, they kind of downplay and say, "Oh, it's just a cold sore." Let's talk about that for a minute.
I mean, it's what it's called, a cold sore, but that's the common name for it. But it is a herpes virus,
right?
So people need to be aware of that. It is transmitted sexually through kissing, contact, and just the virus may be on the skin. You may not see it at all. But when people are infected with the herpes virus, they may get like swollen lymph nodes. They may get a fever, and that will be like 21 days or so after you've been infected with it. Those are the symptoms that you may get.
Right.
You may have an open lesion, ulcer, or nothing at all. Some people have no symptoms and they can pass it on.
Right.
So just be very aware that there may be a lesion or there may not be a lesion.
Right.
Gonorrhea, again, with gonorrhea, you may have painful urination. You talked about that. Abnormal discharge from the penis. You may have testicular pain, and women experience maybe some belly pain, things like that.
Right.
So again, sometimes it's asymptomatic, but gonorrhea, usually you're going to have some type of symptoms. With HIV and AIDS, it's usually like a flu-like symptoms or even a rash within the first 2 to 4 weeks after getting the virus.
Right.
And then it goes into, it hides in the body, and you don't have any symptoms sometimes for years, and so it's very important to get checked for it to know if you have it or not, because that's one that people carry around and they just don't know that they have it. And then syphilis, we talked about that already. Again, it could be it's a painless sore, so it may have an ulceration
Right.
that's pain-free in the genital area, the rectum, or the mouth. Then the sore heals up, and then the second stage is like a rash, and then there's no symptoms sometimes for years and years and years. And then it shows up in the brain, the nerves, the heart, things like that. And so again, it's all about having those exams. If you're sexually active, getting tested for your sexually transmitted infections or any sexually transmitted infections at least every 6 months. And changing partners, you have to have the conversation. Stop being afraid to ask, hey, what's your testing?
Right.
What is,
and quite frankly, if someone, gives you a big pushback, like, like, oh, I got tested, I'm good, or why we need to go get tested. I mean, if somebody, that's a red flag right there, because like, if you're negative, if you're sexually responsible, then why are you afraid? What are you hiding? Why are you afraid to show me your results? So I would definitely raise a red flag on that. So let's get back into these phone lines. We have our next caller. Good morning, Carl. How are you?
Yeah, thank you for taking my call. Yeah, it's a good conversation here and should be had. You just can't be around sleeping around like that, period.
I like that. I like that little phrase.
So,
yeah.
The temptations, then you have to fight off those. You can't sleep with everybody that you see, And then, as far as a man, rubber don't protect everything.
That's
it doesn't.
So true.
Once that fluid transfers and touches your skin, the skin is a cell. You know what I'm saying? It absorbs. So, that casual stuff, and you just got to find somebody and to be with, of course, you might have another, you might go through several people, try to find the right one, but all that stuff out here, you have to be very protective of that situation, because you don't want to catch. I've seen a family member suffer from HIV. So that and no longer here. It went through it for years. And that's nothing. And black folks in our community, it's rampant. It's rampant in the white community too. But our people, now that we know all of this, it's just a person fighting off the temptation. Just like, for example, like the homosexuality thing. A man's body is built from head to toe to be with a woman. It is built. There's nothing between those two. I mean, some people might choose to go that route and do whatever they want to do. That's their life. But a man's body is meant to be with a woman's body, and she is too, to reproduce, for her mind, her knowledge, and and to help the man and the woman. That's just how that is in life. But if people just do anything, and it's a sex-driven society.
Yes.
Not only just racist, it's a sex-driven society.
Yes.
Here in America. But black folks, I just want to say, for black people, we must understand something. We cannot be out here like that, because you take your life, your risk at all time. You take your life. You put your life in your hand when you do something like that just for pleasure. You have to control that.
Yes.
I learned that decades ago. I'm married, but you cannot be out. And I tell my kids this, because I talk to my sons and my daughter. You cannot be out here like that. And once you do that, once you cross that line and keep doing this and that, then you put your life at risk all the time. So I hope our people wake up to this. And it's a terrible situation. And there's nothing fun about it, because that's the only body you have.
Yes.
Once you wrap your mind around that is it. Once it gets in your system,
right.
you basically finished. Your life in so many ways.
Carl, thank you so much for calling. Yes, thank you so much for calling. We got to take a hard break. I really appreciate you. Please continue listening. Call back if you choose. The number here in studio is 313-778-7600. We'll be right back.
Balance of Nature's fruits and vegetables in a capsule, changing the world one life at a time.
I had no energy. For months and months and months, I had no energy, and I'm a very active person. And my husband was noticing that I was tired all the time, and I was slow at everything that I was doing. And I kept listening to the commercials, and, you don't know if something's going to help you or not. But I decided this was something I was going to do. And lo and behold, in about 4 days after taking them, I was repotting plants. I was doing other things. My husband said to me, "You seem to have more energy." And I said, "Oh, yeah, I'm fine." And I'm telling you, nothing has ever made such a difference. So anyway, I'm very happy.
Right now, Balance of Nature is offering free shipping and 35% off on any new preferred order. Call 1-800-2468-751 or go to balanceofnature.com and use discount code RADIO5.
Attention! Do you owe back taxes, fines, and penalties to the IRS? The IRS now offers new relief options for taxpayers affected by COVID-19, but you can't go it alone. Call Tax Solutions now. Our team of former IRS agents and tax professionals can get you the best deal. We know the COVID-19 rules. Call us and never speak to the IRS again.
I couldn't sleep. We were being audited. I called Tax Solutions now, and a great big weight was lifted off my shoulders.
I called Tax Solutions now, and they got the IRS off my back.
Tax Solutions Now had my wage garnishment lifted in 48 hours.
The virus has caused the IRS to take extensive action to help taxpayers. So if you owe $10,000 or more, this is the best time in years to settle your tax debt.
I qualified for the Fresh Start program. I paid less than I owed.
Remember, the IRS will not give up until you pay. Call 800-683-9499. 800-683-9499. 800-683-9499.
So Gorgeous is the latest brand to hit the hair extension and wig market. Made from 100% human hair donors with textures to perfectly blend into your hair, giving you full, natural-looking styles with added volume and length. You can wash, color, curl, and straighten our gorgeous bundles and wigs. Shop our collection now at SoSoGorgeous.com and get ready to show off your gorgeous hair.
WFDF Farmington Hills, Detroit, 910 AM Superstation, a division of Adele Media. The weekend lineup on 910 AM is crazy.
I am your host, Nurse Charms, the nurse of morning radio, here to bring you the most accurate and up-to-date information in health, wellness, nursing, and medicine. Listen, information is power and information is currency, so we do not do misinformation over here. Stay locked in with me, and I promise that you will not be disappointed. From 6 a.m. to 8 a.m., chime in on the discussions that we have on this show so we can hear from you.
910 AM Superstation. The views and opinions expressed on any program are those of the producers and or the persons appearing on the program and do not necessarily reflect the views and opinions of 910 AM Superstation or Adele Media.
back. This is 9:10 a.m. Superstation. You are listening to Nurse Charms Live. We have reached our second hour. If you want to call into the show, the number here in the studio is 313-778-7600. This morning, we are having a conversation about STDs. Listen, don't be embarrassed. Call in. We want to talk about this. We are raising awareness. April, the whole month of April is sexual transmitted infections awareness month. So that is what we are doing. We want to have this conversation. I want to know from my callers, why is it that people are embarrassed, ashamed to talk about their status, to go get tested? What are some of the reasons? Because the new latest data by the CDC shows that there is a skyrocketing increase in the numbers of people who are testing positive for chlamydia, gonorrhea, and syphilis. Matter of fact, the numbers of syphilis have doubled. So we need to be talking about this. So let's get back into our phone lines. We have Sharon. Good morning, Sharon. How are you?
Good morning, Nurse Charm. Excuse me. I know a person that has had cold sores on the lip area ever since the age of 12.
Wow.
Can you explain that? Can it be hereditary?
Well, I know someone has had it since they were a baby, and that's because someone kissed them when they were a baby.
Yep, I was just getting ready to say, yep. Unfortunately, children can get, it's still the same thing. It's not like, oh, well, it's just a cold sore for a baby. No, it's the same virus. It's the same virus whether you're a baby, a child, or an adult. It's herpes simplex 1, and it's a viral infection, and it's a contact virus.
It's not hereditary.
It's transmitted on contact. Yeah. So I mean,
okay.
So
yeah.
Be careful kissing. Be careful kissing.
Mm-hmm. Okay.
Yep. All right.
Thank you.
Okay. Appreciate. Okay. Please continue listening. Hey, Fidel, how are you?
Hey, ladies, y'all can call back. I got two questions. One, have any one of you guys ever looked up the origin of where these diseases come from? Like the history, I heard somebody say don't nobody know about the education of it, but the fact of the matter is, when we came in contact with other civilizations, meaning Africans, we had no history of carrying these diseases. In fact, years later, they injected this disease in. So, one, do you guys know where the beginning come in? And my education taught me when we came in contact with other people that came down from the Caucasus Mountain, the way that they live, and they contracted these diseases, and now it's affected over the whole world. And two, bestiality is on the rise. How do you ladies feel about that? I don't know any animal that smells good that somebody want to lay down and have sex with, but it's been going on and been among us for years. Do you think a lot of these diseases come from that? And when you had Larry Nassar up there in Michigan State, one of the big topics that was going on, but it was covered up, was bestiality. The scientists up in Michigan State was engaging with the animals up there, and they kept that hush-hush. So, one, the origin of these nasty diseases, and two, how do you ladies feel about bestiality? And thanks for taking my call. Peace.
Okay, thank you, Fidel. So, the origins of chlamydia, we're talking about chlamydia, gonorrhea, syphilis, some of these STDs. Do you know where these STDs historically they came from? I mean, we just know that they've been around for several years, and we know how they're spread. But what historically?
No, I don't know historically where they came from. You know, there's always, you know, the stories about syphilis coming from people, you know, laying down with sheep and stuff like this. But no, I don't have, that's not my knowledge base right now of where these diseases originated from. No.
Yep. Unfortunately, they're just getting passed around, and that's what we really need to focus on, getting tested so that people are aware that they have these diseases, and if they have them, getting treated. And then the bestiality, I don't have any research to support that. I mean, I think that's something psychological for people wanting to have sex with animals. That is not normal.
I would definitely advise against it. Yeah, because you don't know.
That's something that is not normal behavior. Definitely, that person needs counseling. That's about the extent that I can say on that topic for Dale. But thank you for those questions. Let's get back into these phone lines. Sherry, good morning, Sherry. How are you?
Good morning. I'd like to ask Nurse Nicky a question. She said that she was also into, I believe, something like natural healing. And my question is, are there natural remedies for these diseases like gonorrhea and syphilis and other, what do you call it, venereal diseases? Thank you.
Yeah, I would refrain from answering anything like that because I'm sure there's some ways that you can alleviate the symptoms, but I don't know absolutely for sure 100% that they're, what the proven method is to eliminate it. So, there's going to be ways that you can, get rid of the symptoms, but only temporarily.
Right.
So I can't speak on that at this point.
Right. There aren't any treatments to get rid of an infection because the thing about it, an infection, that's why they call it sexually transmitted infections. Anytime you have an infection, that requires some type of antibiotic treatment. So there isn't anything, to my knowledge, something that's natural that's going to get rid of that infection. Like Nurse Nicky said, you can get rid of the symptoms. Like for instance, if you have burning, symptoms of burning with urination, there's some pills that can decrease those symptoms. Sometimes people drink cranberry juice, stuff like that. But if you literally have an infection in your bloodstream, it is going to take an antibiotic.
Yeah, I mean, there's some other things that definitely I do naturally, and I can get rid of some stuff. But I wouldn't play around with a sexually transmitted infection because you can, sometimes it may take longer than what it would normally take to get rid of. And in that point, you have scarred your ability to reproduce. And then sometimes these different infections can lead to your heart, like chlamydia later on, ends up having heart infections. So I would go ahead and definitely get tested and get treated the medical way for these sexually transmitted infections. And if you come across some other ways to help remove it from the body, there are some people out there, like, of course, we hear of the Dr. Sebi and things like that. I don't know what his method is, but there are some people out there, I'm sure, that do know it. I'm just not prepared to speak on it, so I wouldn't advise it right now at this time.
Yeah. Hope we answered your question, Sherry. You have any other questions? Oh, thank you for listening. I think our board had a mistake hung up. If you have any more questions, please call back Sherry. Let's get to Emery. Good morning, Emery. How are you? My friend.
How you guys doing? What's going on?
I'm doing excellent. Yes. Get in here. Talk about this discussion. I know you're on the air at 9:10. You talk about relationships all the time. And what about people in relationships not being honest with each other about their sexual health and transmitting these diseases back and forth? Earlier at the beginning of the show, I'm not sure if you were listening or not, but I brought up some data. Black people are 14% of the population, yet 56% of our population are carrying these STDs. So get into it. Let me hear your perspective.
Oh, I'm about to. I will tell you also, yes, I will be talking about the late Kevin Samuels on Wednesday. It'll be my last show because I'm actually out on medical leave, so it'll be my last one for a while.
Okay.
But I would just having surgery. That's all. I'm okay.
Good. Right.
Yeah.
Just got to get a tune-up, huh?
That's all I got to do.
Right.
God told me to sit down, so that's what I'm doing.
Yeah.
So what I would say is this. The data you brought up, let's bring up something else. 30% of the black population is married.
Right.
And start right there.
Right.
Where's the obligation? And not only that, of the 30%, you have men who cheat at 26%, women cheat at 24%.
Yeah.
So when we start to talk about the data, yeah, pretty much. Mm-hmm. So when we happen to talk about the data, we have to really, really start. I would say, why are we not married, for one? And then another thing you had brought up earlier is that now, I think the other nurses said she spoke very candidly about it and said that, hey, the media now promotes sexuality.
Right.
It's okay. It's something that is more of a sexual revolution 2.0, if you will, where now I just had a conversation with someone yesterday and said, hey, why can't we have sex like you guys can?
Right.
Well, you're not supposed to. Women are supposed to think about that. Okay, the goods it should be highly cherished and only given to those who earn it. Now men don't have to earn it because the women want to give it like men did.
Right.
So, and because of that, now we have all these numbers. But to your point, as far as
you got these OnlyFans, what is it? OnlyFans, and I mean
OnlyFans and what's the Tinder or whatever?
Yeah, Tinder, all these hookup spots. It's like you know, it's like normal. It's like, oh my gosh, you aren't doing this, you know. Like you said, what happened to
women want attention, you know. And
yeah,
so it's a natural thing for women to want attention, and so if men are not committing to women and being there and present for them and covering them and being there for them, then they're seeking attention where they can get it from. So now you have more women doing historically what men have done more of.
Yeah.
Well, but you also have to put it this way, and I don't want to pick up all your time, but you also have to say this. If women need attention, the thing is that the one thing that every man wants is the one thing you have. They can buy it, but then those women are labeled, you know what?
Right.
But the women who happen to cherish it are the ones who get the good guy. That guy has to work hard for it, whether it's his financial situation or how he treats her. I mean, he has to give her reverence, saying, "This is the mother. This is the woman who's going to be the mother of my children." I mean, and she has to act like that first and foremost. You can't be, can't be loose in the streets and say, "Oh, I want a good man." It starts right with you. And I think at the end of the day, and I don't want to take up all your time, and I thank you for my time here, but we have to get back to understanding that we both, men and women, black women and men in particular, are very important, and we do have value. We don't have to spread ourselves out amongst each other, having all these babies, and now having all these diseases. Right. I think the biggest thing is unity is what brings us back to a certain level of respect for each other, and these diseases won't go up, marriages will. Thank you so much.
Yes, thank you. You too. Thank you so much. That was great perspective. Let's get to Richard. Good morning, Richard. How are you?
Good morning. This might be off a little bit. I'm 75, and I have what they call shingles. And I was informed that shingles is a form of herpes. And then, let's see, they came up with the vaccine. I got the shots at CVS. Mm-hmm. Years later, this shingles is still here, very painful. So I was wondering, can you get another vaccine? I guess that wouldn't happen, right?
I don't know which kind of vaccine you had. I know that there was 2 different kind of shingles vaccines, and I'm not the most educated. But they were recommending the second one that came out.
I'm sorry. Go ahead. What did you say real quick, Richard?
I got the very first one. So that the only reason why I found out about the second one was just by watching TV, and they had some ad on TV about shingles. I said, well, I already got the vaccine. So somebody must be telling me that one vaccine didn't work.
Yeah, talk to your doctor. Talk to your doctor. There is some information out there that you can get that second one that came out, Shingrix.
Oh, I can?
Talk to your doctor about it.
Mm-hmm. Yeah. Richard, we got to take a hard break. We'll give you more information on the other side of the break. Please continue to listen. This is Nurse Charms Live. We'll be right back.
Hi, this is PG. Today's topic is about school buses and when drivers need to stop. I am here with Southfield Police Chief Elvin Barron and Farmington Hills Police Chief Jeff King with an important traffic safety tip just for you.
When the lights are flashing yellow on
the
Word Network has been broadcasting inspirational messages around the world since the year 2000, and we keep getting bigger and better and more innovative. Seen all around the world, we bring you the best teaching, impartation, singing, and inspiration. If you want original programming, we have that too. The Word Network is your exclusive source for all things inspiration, and we can be found on every device imaginable. If you want to be uplifted and inspired, you need the Word Network.
My 38 is offering a great special that cannot be refused. Are you looking for a great deal on TV advertising? Are you searching for an avenue to get your business name out to the public? With My 38, we are offering a great special with 100 commercial ads for a great price. This offer is for a 30-day ad placement. Please contact Devin C. for more information at 248-357-4566 or email at d.calhoun@thewordnetwork.org. This excludes political ads. Have you thought about advertising your business on our 910 a.m. Superstation? Our audience is bigger than ever, and your investment will be lower than ever. Find out how you can grow your business. Give us a call during business hours and ask for Henry, 248-357-4566. We will tell your story, and more folks than ever before will come to your door. 248-357-4566. Ask for Henry. The super audience at our 910 Superstation wants to hear about you. Call now.
So Gorgeous is the latest brand to hit the hair extension and wig market. Made from 100% human hair donors with textures to perfectly blend into your hair, giving you full, natural-looking styles with added volume and length. You can wash, color, curl, and straighten our gorgeous bundles and wigs. Shop our collection now at sosogorgeous.com and get ready to show off your gorgeous hair.
Happy National Nurses Month to nurses across the world. Thank you for your unwavering commitment to high-quality patient care. You truly make a difference every day in so many lives.
Nurse Charms Live. You are listening to 910 a.m. Superstation. Nurse Nicky is in studio with me. This month of April is National Sexual Transmission Infection Awareness Month. Sexually Transmitted Infection Awareness Month. STI. So we're having a discussion about STIs, or people know it as STDs. They're really kind of interchangeable, but both of these terms. Nurse Nicky, did you have anything you want to say before we get back into our callers?
Yeah. I did want to say that, we're not trying to scare anybody. We do need to create an awareness, though, because a lot of infections are treatable, but you don't want to rely on, just getting treated every time, you get a sexually transmitted infection, because you want to limit the amount of, things that are going into your body, right? And so, when you're looking at HIV, there are medications now. We've come such a long way since the 80s when the infection first came out. So right now they're up to the point where there is like a monthly injection. It's either once every month or every 2 months, which is making a lot of people have undetectable HIV to the point it's not transmittable. And so that's one thing that people need to be aware of. A lot of people don't know. They do have pills as well that people take on a daily basis. And they also have pre-exposure prophylaxis pills. So if you're in a relationship with someone, or you had, you participate in any type of sexual activity, even women that have heterosexual sex, your risk is still there, even though it's higher among men that have sex with men. Those are the statistics. So that pre-exposure prophylaxis medications are available as well for people that are interested in that to prevent infection. And then with syphilis, the injection, antibiotic injection, that's available. With chlamydia and gonorrhea, there's antibiotic that give it a dose. You can either get one dose in the clinic for some things or a course over 1 to 2 weeks. So there are medication regimens that are available for people to take. But again, you don't want to rely on that. And then for the caller that asked about, the shingles being a form of herpes, there's sexually transmitted herpes 1 and 2, HSV 1 and 2, but there's different types of herpetic viruses which are not related to being sexually transmitted. They're still contagious, though. So the shingles is the one that comes from the chickenpox, that comes from when you got chickenpox at some point in your life.
Right.
Then it lays dormant in your body.
And then as an adult, it presents as shingles.
Yeah,
right.
Under some type of stress, you may present as shingles, which can be dangerous because depending on where it erupts at, it could lead to blindness and a lot of pain, which is called neuralgia. So the shingles vaccine is available. There were 2 different types available. And so, again, I just recommend talk with your doctor or your local pharmacist, and they can advise you on, what's best for you as far as the shingles vaccine.
Before we get back into our callers, let's just point out that, like you said, most STDs are preventable and treatable, but there are some that aren't curable. So you want to talk about the ones that aren't curable. Like, of course, there's no cure for HIV, but there's treatment, right? There's no cure for herpes, but there's treatment.
True. Yep. There's no cure. There's no cure for HIV. Again, they have the medications which make it undetectable, which means that you then are not able to pass it along. And not everyone can get to that point, but a lot of people are becoming undetectable. So things with the herpes virus, again, it's not curable, but it's treatable. There are medications that people take to keep it dormant. And there's things you can do naturally to just keep it at bay. But it's not curable. It lays in your nerves, at the root of your nerves, and it just lays there. And when you're under stress, or even when women come on their menses monthly, it may cause a breakout of herpes. Sometimes your diet and things like that may cause it to break out. Right. So again, there's no cure for it. With the human papilloma virus, a lot of times they heal on their own, or they go away on your own. It may take like up to 1 to 2 years for it to go away, though. Some people would clear it. But the dangerous thing about HPV is that some people, it turns into cancer.
Right.
And so that's the dangerous part of HPV.
Right. So let's get back to our phone lines. Hey, PG. You there?
Good morning again, ladies, and thank you for taking my call. And happy TGI Sunday, the last Sunday in April before we acknowledge nurses and our mothers.
Yes.
So happy coming up May tomorrow. So I was watching something on Facebook, and they touched up on it on the news, where this dog went and drank from some water that was in the yard of where he lives. He came back inside, and the owner of the dog obviously was letting the dog lick on the lower part of her leg, like right around the ankle and on her feet and toes, and she got this flesh-eating bacteria. Allegedly, it was a parasite that was in that water that the dog went out there and drank, and then came back in and licked the owner's leg, and just all of a sudden she broke out, and it was some kind of flesh-eating bacteria. Can we say that that's of a sexual orientation, or is it just contaminated water? What would cause a flesh-eating bacteria like that on your body?
So the medical term for flesh-eating bacteria is necrotizing fasciitis. So that isn't a sexually transmissible disease. That is basically you have an infection, and it's causing your tissues to just turn black and not have enough oxygen supply. So that is something different in that scenario that you just described.
Okay. Well, I think we need to get sex education back in school for these kids, and they need to understand that doing fellatio can put you at risk just like penetration.
Yes, that's absolutely important. We do need sex education. That should never be removed from the schools at all. Thank you so much for calling this morning, PG.
Thank you. I'm enjoying the show.
I'm glad to hear that. Thank you for that feedback. Let's get to Jerry. Good morning, Jerry. How are you?
Good morning. I miss you already, guys.
We miss you too, Jerry.
I just want to tell you, my dear Nurse Charm, Nurse Nicky, how much we appreciate your radio talk show. We learn a lot from this conversation, from your answer to the questions of all the viewers. So God bless you for your service. Indeed, you deserve to be called the heroes of the front line.
Thank you.
Nurse Charm, Nurse Nicky, my question in two parts. The part one is any regular blood test will show any disease or system you got in your body. That's A. B, if you take antibiotic or penicillin or anything else, let's say for pancreatitis or for pneumonia or something, is that antibiotic will kill other inflammation in other part of the body? I would appreciate the answer, and thank you very much.
You're welcome. You're welcome. Please continue to listen, Jerry. So to answer your question, STIs, STDs, they can be detected in either your blood or your urine. So depending on what your symptoms are, that is what tests your doctor will perform. But most likely they just do a blood test. It's just easier, but they can detect that in both. Wouldn't you agree?
They can get a blood test and see some things. They can do a urine test and see some things, and then they also do the swabs and they get a culture,
a physical exam. Right, they can swab, vaginal or your penile. Yeah.
Mm-hmm.
Yep. And then also he had a question about the antibiotics. There's this phrase I learned a long time ago in pharmacology when I took that in nursing school. You have to have the right drug to treat the right bug. So each antibiotic is very specific to, that's what we were talking about earlier. Each antibiotic is very specific to what STD that you have. So, for instance, like if you have gonorrhea, if you have chlamydia, if you have syphilis, all those have different antibiotics. And he asked about the side effects. I mean, there's side effects of almost everything out there.
Yeah, I mean, you take a medication for this, and then you end up getting a yeast infection. So it just, antibiotics can disrupt some normal things that are going on in your body, and they have to reflourish. So can an antibiotic, work on more than one issue in your body? I mean, if that antibiotic works on that other issue, yeah, I guess so. But, you can't say, okay, well, you took it for this and it's going to work on that too. Right. You have to have the specifics.
There's some broad spectrum antibiotics, which means that, they can cover a number of different things. But usually, like I said, you have to have the right drug to treat the right bugs. So, they'll do all types of,
the culture. And
right. They'll do cultures and they'll find out what's growing or, what's in your bloodstream or
what antibiotic is specific to that particular bug.
Yep. Oh my gosh, this time
was quick.
This show is going by so quick. Okay, so we have another half an hour left. So 9:10 a.m. Superstation Nurse Charms Live. We're going to take another break. We'll be right back.
Hi, this is PG. Today's topic is about school buses and when drivers need to stop. I am here with Southfield Police Chief Elvin Barron and Farmington Hills Police Chief Jeff King with an important traffic safety tip just for you.
When the lights are flashing yellow...
Did you know most vitamin supplements don't even come from food? Even the products with colorful fruits and vegetables adorning the labels are seldom derived from produce. Typically, supplements are synthetic, made in a laboratory. Modern science may synthetically imitate these chemicals, but your body isn't fooled. It knows the difference, and it craves quality materials to build, repair, and fight illness. You need to consume fruits and vegetables daily in a variety of colors, as well as whole grains and other fresh food. That's why I formulated Balance of Nature. I wanted to be able to give my patients a natural alternative to the cheap, unnatural chemistry by giving them real fruits and vegetables. In fact, the only ingredients inside a Balance of Nature are whole fruits and vegetables. Don't settle for imitation nutrition. Reach for the good stuff, the real stuff.
Call 1-800-246-8751 or go to balanceofnature.com to get 35% off your first preferred order by using discount code RADIO5.
Do you have an idea for an invention or new product? Do you think companies would be interested in your idea? Do you want to try to get a patent? Then call InventHelp now. InventHelp keeps your idea confidential and explains every step of the invention process. We create professional materials representing your idea and submit it to companies who are looking for new ideas. We have more than 9,000 companies who have agreed to review ideas in confidence. If a company shows interest in manufacturing your invention, we can negotiate on your behalf. We have helped over 10,000 clients receive patents. We also offer services including 3D modeling and animation demonstrating your idea, prototyping services, and we use state-of-the-art technology to show InventHelp client ideas to additional companies. Join the thousands of people just like you who chose InventHelp to pursue their idea. We are experienced. We are working for you. We are InventHelp.
Call us for free information at 1-800-460-1663. That's 1-800-460-1663. Again, 1-800-460-1663.
And we are back. This is Nurse Charms Live. We have 30 minutes left, actually less than 30 minutes left. So if you want to get in on this discussion, call us. We are live in studio, 313-778-7600. This morning we are having a conversation about STD and sexual health. April is National Sexually Transmitted Infection Awareness Month. So we wanted to bring awareness that everyone needs to go get tested and know their sexual health status. So the next topic that I want to get into is oral sex and throat cancer. There is recent research that says that the numbers of people with with throat cancer are rising, and they're saying that one of the biggest factors to this rise of throat cancer is people having oral sex. So let's get into this. What did you learn from the research?
Well, I mean, it's basically what we've talked about, that, the oral sex is leading to it. People have the HPV virus. It's invisible on a lot of people, and some people have it. If you're not looking, you can't see anything. You think everything is okay. A lot of teenagers, to avoid actual sexual intercourse, they're doing more of the oral sex, to make it seem like they're not really having sex, but they're still satisfying their urge to satisfy that sexual urge that we know teenagers are having, because they're entering that stage where they can reproduce. And so when I had read about it, there were a lot of males that were coming down with throat cancer. And so is it evening out now? I'm not sure what the numbers are as far as between males and females, but with the high incidence of, people pursuing their different sexual interests, and women with women, and, that type of thing, women and men are getting, they're getting the HPV in their throats, and they're developing the throat cancer. So
I mean, this really surprised me. I mean, this had been talked about years and years ago, right. But when now that I'm hearing 70% of throat cancers is caused by HPV, or the human papillomavirus.
Human papilloma.
That word is a tongue twister for me. It is. So, and when you think about how you get HPV is through sexually transmitted infection. So it's like, dang, like, wow, like that is a really high rate, 70%. I mean, like, sheesh.
Yeah, I mean, other cases of oral cancer are going to be from like smoking to chewing tobacco and things like that. So that most likely is the other cause of it, the higher percentage of it. But 70% really is a high number, so that's totally avoidable when you look at how it's being transmitted.
So let's talk about some of the ways that they're recommending that you can avoid.
Well, to avoid that infection in your throat is to abstain from that activity.
Right.
The other way is to there's a thing
use
called
protection.
Using protection. So with the oral sex, if it's being done on a woman, there's something called a dental dam, which it sounds pretty funny, but it's basically a latex or a plastic type sheet that goes over the genital area, and you would perform oral sex with that covering, so that way that would keep you from having, skin to skin contact and getting that virus within your throat. I'm not sure what the percentage is, but the vaccine is also what's being promoted as a preventative, where there's lots of different HPV strains, and so there's 9 different strains that are covered with the virus, and covering the ones that are seen to cause most of the cancers that are being seen. So that's another option for people, and that's given to children once they're around, I think, like 11 years old or so. So they're giving it to males and females. So prevention is one, talking about it, getting tested, seeing if you have it. Again, it's not really a way to test men for HPV. Women can get it during their pap smears, but there's no real way for a man to get tested for it. You may see some outward signs of warts on the testicles or on the penis, but other than that, if you don't have any visible signs and you may have the virus, there's no way to test men for it. So it's not 100% other than, abstaining and or using the dental dam.
Right. And just getting tested as women, women, it's important for women to get tested and share their results with their partners, so everyone can be safe. Let's get back to our callers. Good morning. We have Tim on the line. Hey, Tim, how are you?
Yes, I'm doing fine, and good morning to you, and good morning to you. Yes, I'm enjoying your conversation. It's strange that you're talking about sexually transmitted disease, because I just want to have my physical done, and my doctor did my blood work and things like that, and he said I was sexually transmitted free and things like that, but when you bring this sexual transmitted disease up, the first thing come to my mind is syphilis. And we all know who brought syphilis on us. Right. And, the government, so I wouldn't be surprised if the government did something to make it, the transmitted disease arise again, because we know how shrewd the government can be. So we cannot have that much of a guarantee, that much trust with the government, because I'm still the believer that they are the one who created AIDS, just to get rid of the gay people or the LGBTQ people, and then it backfired in their face, even though they might not have had a ointment to cure and things like that, and it's backfired and things went haywire and things like that. So I really believe that the majority of these sexual transmitted diseases was brought on by the United States government. Thank you for taking my call.
Thank you, Tim. Thank you, Tim. Thank you for your perspective. Please continue to listen to the show. What are your thoughts on that?
I mean, that was kind of brought up a little bit earlier about, what's the source of the infections. And my thoughts are, we're in this boat now, so how do we prevent, and how do we keep our health? How do we get back to a state of normalcy? And how do we do that? By getting educated about what these diseases are, how to prevent them, how to treat them, and educate the young people. And it's not just the young people. I mean, we had a conversation about HPV and cancers at a dinner that I went to, an educational dinner, and it was a grown man, probably his 40s, if not early 50s, that was totally unaware about HPV and how it can cause cancer, because some of these different cancers are caused, by sexual contact. Right. So it's not just educating the young people, but it's educating everyone. And we had a caller talk about seniors, and we do see more and more seniors that have infections that are sexually transmitted, and it's sad to see. But again, seniors are sexually active, and as we are more healthy as we age, we're also more sexually active as we age. And so we're going to continue to see those type of numbers if we don't get this type of conversation going and get this conversation in the homes with every age group, so that everyone understands what's happening and what we need to do to prevent.
Yeah. So again, the number here in studio is 313-778-7600, 313-778-7600. We are raising awareness about STDs, what they are, how they're treated, how you can contract it. So if you have any questions, please call in 313-778-7600. To kind of wrap all this up, Nurse Nicky, what are some solutions? Because we've been talking about this, the entire show. like where do we go from here? Like what is the government's part in this?
Well, the government's part is, through the CDC and through the airwaves, they can put out national campaigns for sexual transmitted diseases and awareness. So that's one thing. At the local level, in the clinics, we can have campaigns where we are targeting, people as they come into the clinic, having community health workers that are making calls, going out to community events, going into the schools that would allow it to have the conversations. As nurses, we can have the conversations at homes, private gatherings and get-togethers. I think that's real important that, when we get together, that we have some type of formal, discussion about things. But those are things that we can do individually and collectively. In hospitals, emergency rooms is a big area of access. And so that's where a lot of people, especially in the inner city, are going to get their care instead of going to a primary care center. So what can the hospitals do to promote education and promote safety, and so that people know what's going on?
What about federal funding? I know you work for a federally funded facility. Like, do we even have enough STD clinics throughout the community, especially in places like Detroit, where there's a lot of African American population, since we are the ones who are carriers and positive of STDs. Earlier I was talking about the percentage is 56%. So what about having more STD clinics throughout the neighborhoods? Throughout the communities? What about having a program where we can get free STD kits?
Well, we still have the Department of Health, so that's one avenue of access. Again, people don't know what their resources are. I worked in the hospitals for years and did not know about federally qualified health centers. And you can walk into a federally qualified health center and be seen just like you can walk into an emergency department and be seen. And so those are in place to help people with the resources. But if you don't know that they're there and that you can just walk in and be seen, then how do people know that they have that resource? So in the absence of like the Herman Kiefers of yesteryear,
right,
know that federally qualified health centers are available. They're federally funded. You can walk in. It's based on, if a lot of people have insurance, and so of course it's covered. But other than that, if you don't have any, if you have low income, it's based on, what your income is. And so some people don't have to pay anything.
So is it like a sliding scale coverage? Can you just pay cash?
Sliding scale fee. So a sliding scale based on your income. And again, some people don't have to pay anything.
All right. This is our last and final break. This show has went by so quickly. We're going to take our last commercial break. This is Nurse Charms Live. You're listening to 910 AM Superstation. We will be right back.
If you've been injured in a car, truck, or motorcycle accident, the insurance companies never want to pay. Hello?
Listen, David, I'm telling you, we won't pay.
No, I'm looking at the case right now, and you will pay.
No, we won't.
I'm absolutely positive
we won't.
that you will pay.
No.
Okay, that's it. No. When the insurance companies say they won't pay, I will make them pay you. Get the money you deserve at GetDavidGetPaid.com.
Balance of Nature's fruits and vegetables in a capsule, changing the world one life at a time.
I had no energy. For months and months and months, I had no energy, and I'm a very active person. And my husband was noticing that I was tired all the time, and I was slow at everything that I was doing. And I kept listening to the commercials, and, you don't know if something's going to help you or not, but I decided this was something I was going to do. And lo and behold, in about 4 days after taking them, I was repotting plants. I was doing other things. My husband said to me, "You seem to have more energy." And I said, "Oh, yeah, I'm fine." And I'm telling you, nothing has ever made such a difference. So anyway, I'm very happy.
Right now, Balance of Nature is offering free shipping and 35% off on any new preferred order. Call 1-800-2468-751 or go to balanceofnature.com and use discount code RADIO5.
Attention! Do you owe back taxes, fines, and penalties to the IRS? The IRS now offers new relief options for taxpayers affected by COVID-19, but you can't go it alone. Call Tax Solutions now. Our team of former IRS agents and tax professionals can get you the best deal. We know the COVID-19 rules. Call us and never speak to the IRS again.
I couldn't sleep. We were being audited. I called Tax Solutions now, and a great big weight was lifted off my shoulders.
I called Tax Solutions now, and they got the IRS off my back.
Tax Solutions Now had my wage garnishment lifted in 48 hours.
The virus has caused the IRS to take extensive action to help taxpayers. So if you owe $10,000 or more, this is the best time in years to settle your tax debt.
I qualified for the Fresh Start program. I paid less than I owed.
Remember, the IRS will not give up until you pay. Call 800-683-9499. 800-683-9499. 800-683-9499.
So Gorgeous is the latest brand to hit the hair extension and wig market. Made from 100% human hair donors with textures to perfectly blend into your hair, giving you full, natural-looking styles with added volume and length. You can wash, color, curl, and straighten our gorgeous bundles and wigs. Shop our collection now at sosogorgeous.com and get ready to show off your gorgeous hair.
Happy National Nurses Month to nurses across the world. Thank you for your unwavering commitment to high-quality patient care. You truly make a difference every day in so many lives.
And we are back. This is our last and final segment of this show this morning until next Sunday. We've been talking about STDs because April is National Sexually Transmitted Infections Awareness Month. So this has been a great discussion this morning. Callers, y'all been off the chain as usual. If you want to get in real quickly before the show ends, you can call us here in studio, 313-778-7600. We are going to get back into these phone lines. Good morning, Jerome. How are you?
Good morning. I'm doing almost as good as you ladies.
Thank you.
I just want to remind everybody that as we're talking about diseases, there was legislators during the pandemic who wrote legislation that if it would have passed, it would have affected us tremendously. What they wrote was you could not use economic status or race as a basis to distribute the vaccine. And had that passed, what it meant, it could have went everywhere else except for where it was needed the most. Our health, Herman Kiefer was closed. And we're still under laws and policies of emergency management. And we should not give our government a pass on this. Let them know that they were wrong and let's correct this.
Yes.
We need to get back to that each one teach one, each one reach one mentality.
Yes, our lawmakers need to know. Mm-hmm.
Yes, they do. So the only thing I want to say is everybody do their homework. Let's put in something that'll change the world. Let's put our history in the history books with a forced certification for everything that we do. Know the real story.
Yes, for sure. What are some reasons that you think that Black people in general really don't want to talk about these topics?
Well, we're not, the first language that a child learns is sign language. It's not the textbook language. It's the expressions on their face. And what we're influenced by the most is the one thing that we don't pay attention to. We don't own not one major distribution system. We don't own one major news information or communication source. And we're not in control of our education. A lot of people don't recognize what made the emergency management start in the first place. It was white contractors who didn't feel that they were going to get a fair share of the children's $1 billion bond money. And they went to the governor, and the governor said, if you're not going to get it, we're going to take it all. And that's what they did. And we're still in that system now. We need to reverse all those policies to put us back where we need to be.
All right. Thank you so much for sharing your perspective and calling Nurse Charms Live. I appreciate you. Please continue to listen. Let's see. Let's get to our next caller before the end of the show. O'Neill. Good morning, O'Neill. How are you?
I'm doing wonderful this morning. How are you, Nurse Charms? How are you this morning? Nurse Nicky?
Good morning. We're doing excellent.
Yes, it is. What a beautiful morning. Yes, I was calling Nurse Charms to ask you. I have a female primary. My female, she's a female primary doctor that I attend, and I'd like to know: do you have male patients?
Do I have male patients?
Yes.
I work at the hospital, so I don't see patients privately. I'm staffed.
Okay.
I'm staffed at the hospital. Yeah, I'm a staff bedside nurse.
Okay, and you as well, Nurse Nicky.
Yeah, I'm a nurse administrator in the clinics. I mean, we have male patients. But I'm not an individual provider.
Right.
Okay.
Maybe I'm misunderstanding. Were you asking, are we providers, or are you asking, do we just see male patients in general? Because if you're asking, do we see male patients in general? Yes, I do see tons of.
Yes. That's my question. I'm satisfied with my primary doctor I have now. I just want to know, do you have quite a few male patients? Because I was I've had her now for maybe 3 years, and I was sort of a little uncomfortable about it, but she seems to be doing well. It's okay. And I just want to know, did you two have male patients or male, providers?
Yes, I'm an ICU nurse, so generally I'll get 2 to 3 patients because it's a small number because that's per shift. But it's a small number just because these patients are very critical and we're spending lots of time with them. But I would say that I do get a lot of male. There's a lot of male population coming through the hospital.
Mm-hmm.
So yeah,
okay.
and
we see them in the clinics too. Yeah, men come in.
Right, so it's just interesting to see the different diagnoses that men have versus women, and so.
Okay. I was, Nurse Nicky, what was that? I came in on the end of the show. When I hear you guys on live, you sound so great. It's so
thank you.
Nurse, what was a sort of you said you was at a meeting where some of the gentleman was there and he didn't know the certain name of, what was it, HPV, something like that?
Yeah, we were at a dinner meeting and we were discussing cancers, and we talked about how some cancers can be developed from sexually transmitted infections, and one for sure is the human papillomavirus, known as HPV.
Okay, hold up. Say that again. Say that again. Let's make it nice and slow. What was that?
Human papillomavirus.
Okay.
Also known
now
as
that's
HPV.
Been around how long, Nurse Nicky?
Decades. It's been around a long time. Yeah, I don't know. Wow. I can't give you a time frame, but it's been around a long time.
Okay, and it affects both male and female?
Yes, it does.
Okay.
But the thing is that males are pretty much asymptomatic.
And there's no way to test it.
And there's no way to detect it. So, again, our whole reason for having this show is to get tested, especially women, because there are some symptoms and signs that men don't have. And, if you are positive for any of these STDs, make sure you share that with your partner so the disease doesn't just continue to transfer back and forth.
That was and also the caller Jerry. That was a good question Jerry asked, and you gave him a great answer, Nurse Charles, about the blood testing. Different things that you can find when you do your blood testing. That was a good answer you gave.
Thank you. I appreciate it. I try to do my best to give you all the facts and all the truth.
Keep up the good work. You guys have a great show.
Thank you. Thank you so much for calling. Please continue to listen. Please, next week, you're going to be here with me next week, Nurse Nicky?
Next week, I'll be here with you.
Look, she didn't even know it was a surprise. She'll be back next week. All right. And Nurses Month begins tomorrow, right?
Yes, it does.
Yep, tomorrow is May 1st. So let's just talk real quick about some of the issues in nursing.
Some of the issues in nursing that, nurses are stressed out to the max. And we talked about before how nurses are leaving the profession. So we want to keep them on board. They need to have good schedules, the physical demands. They're exposed to illnesses, of course. Technology is changing the treatment from patients, abusive sometimes.
Yes,
so, recognize the nurses for the great work that we're doing out here.
Yes, we appreciate that recognition. And on that note, we will be ending this show. We'll be back live in studio next Sunday. Please join us here 6 a.m. to 8 a.m. You all have a great weekend, great Sunday, and stay healthy.
If you've been injured in a car, truck, or motorcycle accident, the insurance companies never want to pay. Hello?
Listen, David, I'm telling you, we won't pay.
No, I'm looking at the case right now, and you will pay.
No, we won't.
I'm absolutely positive
we won't.
that you will pay.
No.
Okay, that's it. When the insurance company